I'm Dr. Victoria Othersen, Family Medicine with Franciscan Physician Network. I decided to go into family medicine because I wanted to take care of grandmoms and babies and mothers and fathers, and I wanted to know the backstory. That's particularly why I chose this practice. I have patients up to 100 years old at this practice, so I have them and children and grandchildren and great-grandchildren. You get the full family. You get something I think you don't get in specialty care. You really get to know the person and you become part of their family. When I meet a patient for the first time in the office, my goal is to make them comfortable. I like to familiarize them with how I practice medicine and the expectations I expect they have of me and what I have of them. I often use a football metaphor. I'm the quarterback and you're my receiver. If your arms are open, we're going to have a good play. If your arms are closed and you're not willing to play the game with me, it's going to be very difficult for me to care for you. So I expect all of us to be team players, but I also tell them, I'm going to give you advice as your doctor. You're going to decide what to do that's best for you, and I'm going to be fine with that, whether you take my advice or not. As long as we have a good discussion, it's fine whatever you decide to do. I am most passionate about how our lifestyle affects our health, especially nutrition. I have a degree from Cornell, or certificate in plant-based nutrition, and I think we don't realize how much we eat affects our diabetes and our blood pressure and our health, or what our lifestyle changes are doing. So I think if people start to see that they can make a change with their diet and their lifestyle, they realize they have control over their health. It's not just me giving them medicine, it's them participating. I chose to be a Franciscan physician. I interviewed at multiple facilities, including other big hospital systems in the area, and I felt at home here, especially at Beech Grove Family Medicine. When I'm not at work, I enjoy backcountry camping. We hike, we canoe. My partner and I do kayaking. He usually says I splash him. I try not to, but I do. And also, I don't do it anymore professionally, but I used to be a chef, a vegan chef. So I still enjoy cooking a lot, and I still cook for friends and neighbors quite a bit. In my work, there's lots of new tools, there's lots of procedures, but honestly, I'm very old-fashioned. I like old medicines, I like cheap medicines, and I like talking to my patients. There's nothing that takes the place of time. If you can sit and listen to a patient, it's going to give you so much more information than any test or procedure. And I do all those tests and procedures, but that's not what makes me a good physician.